This day of recognition was initiated by the International Network for the Prevention of Elder Abuse and the World Health Organization at the United Nations in 2006. It remains an important observance, reminding us of the need to protect our older generation from abuse and neglect. World Elder Abuse Awareness Day aligns with the United Nations International Plan of Action, emphasizing elder abuse as a critical public health and human rights issue. Health, Wellness, and Elderly Affairs Minister Honorable Moses Jean-Baptiste noted that by shining a spotlight on elder abuse, our nation is encouraged to take proactive steps and support justice for older persons. He emphasized the importance of making a collective commitment to prevent abuse, to lend support to those in need, be their voice when they cannot speak for themselves, and take actions to protect them. Jean-Baptiste highlighted that in line with this year's theme, let us look beyond age and put effort into changing the conversation about aging. The government of St. Lucia is dedicated to transforming perceptions of aging. He encouraged families, communities, and educational institutions to recognize that aging is a lifelong process. His ministry is actively working to foster this understanding for the benefit of our older citizens.
As part of that conversation of change, all programs implemented by the ministry are carried out to benefit all citizens, including older persons. Persons diagnosed with diabetes and hypertension receive their medication free from public health facilities. The 80+ program continues to benefit our older citizens, where they receive all available medical services free at primary care government facilities.
He also stressed that we should not wait until we are 65 or older to start addressing aging issues.
Preparation for old age begins when we are young. It begins with making healthy choices in our earlier years, making good choices about the foods we eat, the activities we engage in, and the financial decisions that we make. With the right approach to planning for older age and our government's commitment to making health and wellness services accessible, affordable, and effective, we can grow healthier, stronger, and more independent in our later years.
The minister shared that efforts are underway to expand services available to our elder population. As universal health coverage is being rolled out, the ministry will continue strengthening health services to make them more accessible. Additionally, through the newly established Elderly Affairs Unit, they are developing a national policy for older persons, a comprehensive guide to managing the challenges of aging.
I take this opportunity to express gratitude to the various ministries and organizations such as the Ministry of Equity, Social Justice and Empowerment, National Insurance Corporation, the National Councils of and for Older Persons, the St. Lucia Pensioners Association, community-based organizations like the Club 60s and Mothers and Fathers groups, the Home Care Program of the St. Lucia Social Development Fund, and the many faith-based organizations and charitable groups who have been integrally involved in the conversation of healthy and active aging.
He urged everyone, individuals and the nation, to continue changing the conversation about aging, to look beyond age, and to commit to treating older persons with care, love, respect, and dignity. He called on all to take action to stop elder abuse and to ensure our seniors can age safely and comfortably. Shane Stephen, NBC Prime.